Hi, this is Seth Kahan. Welcome to my podcast on Grand Challenges. Today, I'm especially excited because we're going to be talking with Dale Cyr, the CEO of Inteleos. Welcome, Dale.
Hello, Seth, and great seeing you.
Yeah, good to see you too. We've done some amazing work together, so I'm really pleased to have you on the podcast. I know it's going to be very good. Let's start off, though, educating our listeners about what Inteleos does. Tell us a little bit about Inteleos.
Well, Inteleos is a nonprofit healthcare certification organization in which we, validate knowledge, skills, and abilities of healthcare professionals in all sectors: physicians, non-physicians, nurses, etc. About 75% of our business is in the field of diagnostic ultrasound, primarily certifying sonographers, the non-physician experts in medical ultrasound sonography. But within our portfolio, we also have some primary boards, if you will, physician boards, especially in cardiology, and also vascular medicine and certifications in vascular surgery as well. So we have quite a gamut, not also including midwives, etc. But we have just over 150,000 certificates. We're in about 100 countries around the world, and we are actively pursuing our mission, which is basically making sure healthcare professionals know what they're doing around the world.
Yeah, let's talk about proficiency. Why is proficiency important?
Well, proficiency is important for patient safety, and which is really what our mission goes to, which is around access to, equitable access to global healthcare for patients. So healthcare professionals, obviously, they have a lot of great education and training, and then, they get their primary certifications where that may be. But even more importantly, once they get their primary certification, their ongoing career life learning pathway is certainly important, especially within healthcare. So much of healthcare changes so quickly that it's key to healthcare professionals stay, practice at the top of their license, if you will. So, assuring patients that their healthcare professionals that are taking care of them show or demonstrate proficiency in the knowledge, skills, and abilities within their practice is essential.
And let's dive into medical ultrasound because speaking of healthcare changing rapidly, medical ultrasound is no longer these big machines that you have to wheel into a room like it once was. What's going on with medical ultrasound today?
Well, it's a great pickup, Seth. Ultrasound equipment has changed extensively over the last decade. And, the ultrasound equipment used to be like the size of your washing machine type of thing. But now really it's miniaturized, and it's even to the point where now you can practice and use ultrasound equipment that's tied into your cell phone, into your iPhone. And so not only does that make it more portable, but the cost barriers and the cost of these equipments has dropped dramatically. I would say for the handheld ultrasound units, costs are around $2,000 American, and those are dropping. That's a significant decrease in for around the world, where practices, regions, countries, low and middle income countries could not have access to this type of equipment before. They now have access. The key is to healthcare professionals know how to use it. And that's where our board feels that Inteleos should play a significant role, is to ensure that there's some standards of practice or standards of proficiency for healthcare professionals to use this powerful diagnostic tool.
So when they were the size of washing machines, what was the approximate price range for something like that?
They could still run upwards of $250,000, $250,000, but I think on average now they're probably around $150,000. So a lot of that's just out of reach, and plus they're not really mobile or portable, so you could not get into rural areas where there was not access to this type of healthcare. But now there is, and again, reflecting back, it's key that healthcare professionals who are going to use ultrasound know what they're doing. And the other barriers that are broken down is really the areas of specialty. Non-traditional users of ultrasound are now using it, whether it be, pediatricians, family practitioners, nurse midwives, clinical officers in rural areas around the world. They now have access to this equipment, and they want to use it to enhance their clinical care. So this is where we feel that we can customize and personalize to the local practices to assure that this equipment is being used properly and it can actually enhance clinical care.
Boy, so when you think of a much less expensive device, you think super portability, it really becomes something that could just spread around the planet extremely fast. And I've heard people say that you can use a medical ultrasound device to replace a stethoscope as well. Talk a little
Yeah,
bit
there's
about that.
there's a growing population in healthcare, including us, that does believe that ultrasound will largely replace the stethoscope over the next decade. So if you think of how the stethoscope is being used across all types of healthcare professionals in all types of setting, and you replace that with a small ultrasound unit, it gives you a size of the impact of what this technology can do for healthcare.
Right, and it can do so much more than a stethoscope. That's what we're going to get into. So let's talk about the Inteleos Medical Ultrasound Proficiency Grand Challenge. How did you conceive that? Tell me about the origins of that, and then we can talk about what you're doing today.
Well, the origins goes back to us observing what's happening with the ultrasound equipment and all the barriers to practice to use this equipment. And again, the Intelios board really felt that our organization should kind of lead a global challenge, if you will, and focus to assure the healthcare professionals know what they're doing. So consequently, we got a hold of you, the Grand Challenge Guru, to help us formulate a Grand Challenge, which is really it's an idea, if you will. It's a transformational idea that's really big to kind of focus an organization and get something done. And in our area, we wanted all users of healthcare, of ultrasound in healthcare, to be proficient by the year 2030. Now, that's clearly a moonshot, but it gives us a focus and a direction of where to go. And then you set up your strategies underneath that to execute it. So our Ultrasound Proficiency Grand Challenge has been underway for several years. And particularly, we wanted to focus in one area, which was maternal health. And so we wanted to drive this new era of the use of ultrasound equipment with new non-traditional healthcare professionals into maternal health. And we really felt that our biggest impact would be in low to middle income countries in which this resource was new. And so we decided that we would highlight the African continent. And through some analysis, we chose Kenya to do our first pilot with this grand challenge, simply because of Kenya's healthcare infrastructure, technological infrastructure. We thought that that would be a good way to move forward, which we have, and we've been quite successful focusing our strategies into this grand challenge within Kenya.
And when you think of healthcare, maternal healthcare, fetal healthcare, I understand the mortality rates in Kenya were clearly could be improved through the use of medical ultrasound. That formed the basis of the initial work that happened there. Is that right?
Yeah. And our particular strategy and objective within Kenya was that we wanted to decrease maternal mortality by 5% in 5 years. Right now, I think according to World Health Organization, maternal mortality is about 580, maybe 600 per 100,000, which is quite high. And and so going in and working with the Kenyan medical community, and particularly the obstetrical communities, we've worked together in which we formulated to their practices, to customize their practices, how can ultrasound best be used? And so they came up with there's basically 7 things that a healthcare provider providing maternal care should know when using handheld ultrasound. These 7 things is predicted that would save thousands of women's lives a year just in Kenya. So we are using our expertise of how do we develop systems of demonstrating proficiency and ongoing career learning using customized local practices. And so it's become a great partnership moving forward. And just within 2 years, we have a policy within the Ministry of Health that requires obstetrical point of care ultrasound, which is really the handheld ultrasounds, requiring specific education training and certification throughout Kenya.
So now, if you just went to Kenya on your own as Intelios and suggested this idea, you may or may not be received well, but you actually built an alliance in Kenya. You brought in many different partners, different types of partners. Now this is where we start getting into ecosystems and interaction fields. This was a clear vision that you had. I remember working with you at that time. You understood very deeply what an interaction field was, and you set about building one in Kenya. Talk a little bit about that.
Yeah. Well, I'll take a step back from that, and that is, going through the systems of a grand challenge. And you brought forth, your 10 steps of building a grand challenge. And one way or another, you have to kind of hit all those 10 steps to have a real successful grand challenge, or at least the infrastructure to be successful for a grand challenge. One of those is collaboration. And because you can't do it by yourself. And we knew that. And so you have to go in with an open mind and start working collaboratively with building an ecosystem or a collaborative partnership wherever you go. At the same time, there's this book that came out called The Interaction Field, which talks about ecosystem development, collaborative, shared value, collaborative business models. And Inteleos has actually adopted that as our primary business model. And so that worked beautifully together with the Grand Challenge. And so going into a Kenya or anywhere we go, we look for shared value, collaborative efforts to get whatever we need to get done. But it also has to be a win-win for the collaboration or ecosystem partners as well. It's my belief that you just won't get very far unless you build these type of shared value, collaborative ecosystems moving forward, which is a distinct part of a Grand Challenge.
Right. Let's talk just a little bit about that. So you said that the interaction field has become the primary business model for Inteleos. So describe to me kind of what an interaction field is and how it could be a business model.
Well, first of all, psychologically, as an organization, you have to realize that probably 95% of the things that you want to do, you cannot do by yourself. And so you have to actively go out and look for partnerships that can be um, collateral value for you or primary value, in which it could be for-profit partnerships, whether it be in the case of ultrasound, it could be equipment manufacturers, it could be other OEMs that are involved in the space. It can be other professional societies, medical societies, healthcare communities working together for us for the primary mission of assuring that for patient safety, that healthcare practitioners know what they're doing. Yet within that ecosystem, ultrasound manufacturers may see this as that we can sell more ultrasound equipment. That's great. Healthcare communities may also see that they may be adding value to their professional society memberships, uh, having this type of pathway. Everyone's getting a win for their purpose as long as it's ethical, and moving patient care forward is what we care about, being the primary driver of this. But you build these ecosystems, each plays a role in moving everyone forward. And this is where it gets to be shared value. It may or may not have primary financial benefit, but it certainly, from our perspective, would have a mission benefit of assuring that healthcare professionals know what they're doing to increase patient safety.
And two other kind of communities, if you will, in that stakeholder system that I was particularly aware of. One was the midwives themselves. I remember being on Zoom calls where we had representatives from the midwife community, and the other was the ministry, the government. And talk about what motivates those two groups, and because it's really different than what would motivate a professional society or an equipment manufacturer.
Yeah. Well, the ultimate, I think, purpose of these type of partnerships is for patient care. And so the midwives in Kenya certainly want to provide the best possible care for the patients. And so using ultrasound as a tool which can enhance their clinical care. And then also integrates them within a system within Kenya for referrals and getting better care, et cetera, et cetera. So that helps there. The Ministry of Health, on the other hand, they also want to have the best possible policies and infrastructure for their population, healthier population, better economic outcomes, et cetera, and that type of thing. So maybe a little different reasons, although ultimately it is about the patient. Both of them kind of come together in this collaborative shared value ecosystem to get what they want to get done, ultimately, which benefits the patient within that particular ecosystem.
And if we just talk about the wins that are already beginning to take place, one of them you mentioned early on, which was the implementation of a policy or the adoption of a policy after just 2 years. And I know from my experience, 13 years at the World Bank, that's fast. Tell us a little bit about that.
It is fast, fastest in my career that I've ever seen. Well, you had a willing Ministry of Health that was looking for opportunity to do something. We had a fully engaged medical community that wanted to do something, and realizing that this particular tool, ultrasound, could really enhance not only maternal care but all overall population health in time. So again, going back to that ecosystem, we all came together, um, and we wanted to work with the Kenyans, uh, and just provide our expertise of what we could do. But we certainly didn't want to be dictating any type of practice or here's how you go about doing things. It was a collaborative effort. You build trust within the community. And once you start building trust, then you start having open conversations, communications, and then the ecosystem really starts moving in that regard. So because of all that, the health ministry felt that support, it aligned with what they wanted to get done. And so health ministries can just make things happen. And they did.
Wow.
Yeah.
Now you had a person on the ground in Africa who was working, and then you actually went over there with your staff and facilitated a stakeholder meeting. Is that right?
Yeah. It's important that you have local people running the program. We do have a program manager in Kenya that's facilitating all of this, but certainly myself and our chief business development officer Pamela Reeves went over, and the initial thing was to bring stakeholders together, let them know what we were about, gain trust, and listen. And so I think we had 15 or 20
Wow.
related professional organizations at that initial stakeholder meeting, in which at the end of it, the outcome of that was that they agreed that midwives and other clinical officers should be doing ultrasound within Kenya, which was a great move. Ministry of Health was there as well. They heard all this. Over the next 2 years, things were churning. Just last November, we went back, had another stakeholder meeting, and it was just really kind of heartwarming to see how far that community has moved forward and just ready to implement. And we are. And we are right now. We are starting to build a train-the-trainer program in which we want to train upwards of 800 healthcare professionals in Kenya, in which then the educational learning programs start taking over and becomes a sustainable program, which is very important for us and for the Kenyan government. And in fact, for anywhere, is that we're there for the long haul. We're just not there to be, a quick hit in and out. We're there for the long haul, and we want to build a sustainable infrastructure to make this successful. And I think we're well underway to do that.
When you started a few years ago, USAID was one of your partners, and of course, USAID has been shut down now. Where does that leave you in terms of the work that's taking place in Kenya?
Yeah, well, part of the Kenyan program was funded by USAID, and of course, it was very sad news to have our funding terminated. But the Inteleos board of directors wants to keep this program moving, and it was great because actually last November when we went back to Kenya, I took the chair of our board
Hmm.
with us, and she got to see firsthand the impact what this was having. So Inteleos board of directors will keep funding this program moving forward. Of course, we're looking for other funding pathways to get this done. So if anyone in your audience is interested in this type of program and would like to maybe work with us to become part of this ecosystem, please reach out and get a hold of me. You can do it on LinkedIn or on my email, dale.cyr@inteleos.org. But I'd be happy to talk with anybody to help anyone get involved with our ecosystem for the handheld ultrasound practices.
Wow. So here we have a grand challenge. It's on the ground in Kenya. It's making a difference in people's lives. There's policies being adopted. You have an ecosystem that's emerging that you're helping to sustain. How does this fit into your larger kind of vision of proficiency around the globe? How will this connect to other activities that you might do?
Yeah. Well, particularly maternal health, we feel that once we're very close to having a system templated in Kenya, and there's already other East African countries that wish to kind of take this on. So I think the probability of this spreading through East Africa and the rest of the continent is quite high, and so that will become its full-time system in itself is to build that out and thinking of the impact we can have on maternal health on the continent is quite dramatic, I believe. Not only for maternal health, but what's the next step of the outcome of what's the social economic impact of that? And that's where real research, I think, can happen. And again, if anyone's out there that would like to start talking with us about that type of outcome, social economic impact, I think would be important. As far as the overall grand challenge in ultrasound, portable ultrasound, it goes across many clinical sectors. And I think our impact there is to assure healthcare professionals that are using this new miniaturized equipment to enhance their clinical abilities and clinical practices is there. And so, we're moving in all areas. We do have a dedicated point of care ultrasound council that's underneath part of the Inteleos or underneath the Inteleos heading, and all areas of clinical practices being developed there for proficiency work. So that's building as well. So you can go to uh, pocus.org. You can see that that's our main driver of the program for the handheld ultrasound units.
And you've actually been looking at potential changes in governance to support this kind of scaling. Um, Talk to me about
Yeah.
that a little bit.
Yeah, well, Inteleos actually was the transition of that because the initial founding organization, which was called ARDMS, um, we really had to transition. We realized that back in 2014. So over the next few years, with your help and others, we transitioned to Inteleos, which became a much different type of organization from a governance perspective. It allowed for global scaling and also much easier for um, different sectors of healthcare to be involved with Inteleos. And so consequently, because of that governance structure, we're able to, in fact, do the grand challenges that we're talking about, that we are driving in all areas of the business, really, but particularly right now in ultrasound.
So, as I've been working with you over the years, one of the striking elements of that work is that you are always investigating new business models, new ways of doing things, digesting that, folding it into the board, and then into the operations. It's a very exciting place to work at Inteleos. When you walk in the building, it doesn't feel like Washington, D.C., it feels more like Silicon Valley. But that extends beyond kind of the superficial, colors on the wall and the way the conference rooms are organized, and it moves into the meetings themselves. I know that there's just a high amount of collaboration with the senior leadership team. How have you been able to generate that?
Well, I do think it's from our mission of, people. I think people do join Intelios because of the mission. And I also think is that they realize that it is a progressive work environment. So I think with both of those areas, we do get the top talent that we get within Intelios, which I'm very proud of. We do look for always different business models and the way of doing things. The world is changing very quickly. And I think it's even accelerated over the last year and a half, maybe two, with AI coming on board. We do know AI will fundamentally transform the type of work that we do. But I also believe that we are able to evolve with it and change it and embrace AI as a cognitive partner, not only for our purposes from a organization, but also to our healthcare professionals.
Beautiful. It's very exciting to watch. So, go ahead.
It is exciting. It is challenging, but it is exciting. We are, I think, in a very unique time, certainly in my professional career. And I think over the next 5 years, I think we will be seeing some dramatic transformational changes, not only in society, but also how businesses are run. And I think ultimately it's for the better.
And give me a sense of what you're sensing about the future in that regard.
Well, I think from a business perspective, I think the ability for staff or humans to interact with AI I call it to be a cognitive partner, not a replacement, but a cognitive partner, in which you can use that as a coach or as a colleague to help you do work and maybe some more remedial work that people don't like to do. I mean, everyone does work they don't like to do, but AI and AI agents, I think, can play a large role in to do that, which allows individuals to grow professionally, maybe adapt new skill sets and start doing things that can contribute to an organizational mission or purpose at higher taxonomy or cognitive levels. So I think that's very powerful. And I think that upskilling of staff, leveraging AI, I just think those are great opportunities that most people would really enjoy.
Yeah, I know right now with AI for myself, it has really just streamlined a lot of the tedious work that I do, and it puts me in the creative seat really fast. Right? So suddenly I'm dealing with content, I'm able to leverage my expertise. And that's
Yeah.
today. what's coming, you know?
Yeah. Well, always remember today is the worst day AI will ever be. It's gone so improved as it's changing so quickly, and now there's certainly negatives to this. I think there needs to be heightened awareness of outputs of AI, AI biases. I think I'm very big on biases, and we need to be careful of that. Today, there's still hallucinations and there's just false information. So it's still in algorithmic language. There still needs to be supervised learning in which there's human in the loop or human at the helm. And I think, especially in healthcare, that's going to be true for many years to come. So thinking that you're just going to be replacing healthcare professionals or workers within healthcare, whether it be clinical care or professional societies, I think just will not happen for many, many years, if at all. So I think that those workforces are safe as long as they work with AI.
Okay, Dale, thank you very much. This has been a great conversation. I appreciate your expertise and experience.
Well, thank you, Seth, and great seeing you. And thanks for everything. And keep up the great work.
Take care.